someone will be answering this question first. Healthcare reform has been hotly debated over the last couple of years. Of the proposed reform plans, which do you support or oppose? Which elements do you support or oppose and why? And what proposals, if any, to reform California's healthcare system would you put forth?
I opposed the governor's health care plan, and I opposed Fabian Nunez's health care plan that passed the state assembly in December. I do not believe that we need to have a complete overhaul of our healthcare system. We do need reforms, but not a complete overhaul. We should not be taxing doctors. We should not be taxing hospitals. We should not be mandating to small businesses who can't afford it that they should be the ones that have to make sure that there's health care for their employees. That's not the right approach. What the right approach to making changes in our health care is to have more of a free market approach. In the state assembly, we introduced 18 bills on the Republican side, 18 bills that would help reform our health care system with free market ideas. What we need to do is we need to have health savings accounts for people so they can afford health insurance. We need to be able to allow people to buy catastrophic health care so that in case of emergency, they would have coverage if they so desired. We also need to be able to give tax credits for charity care. So doctors, there will be an incentive for doctors to be able to take care of those people who cannot afford insurance. There are ways that we can take care of our health care problems without putting mandates on people like businesses and continue to force businesses to leave our state. So I would support doing more of a free market approach.
Healthcare is one of those items which can spend endlessly. You know, if the proposal is to have $10, $20, $30 million, double it. Because nobody knows what it's going to cost. There is no bottom to this. Governor's plan and the legislative plan. I don't think it works. I don't think taxing the employers, taxing the hospitals, and having a tax on the cigarettes, this is totally going in the wrong direction. We are taxing our people. We should be trying to give as much room on a free market basis. Let the market decide what is right for people. The idea of putting the government bureaucrats in charge of healthcare is troubling and makes no sense. Look at the federal government problems in handling Medicare and the state's problem in trying to manage medical. Have you gone to the DMV and the long lines? They can't even handle that. Let's just go across the border. Ask the Canadians if their system really works. It doesn't. It doesn't. You have to stand in line to get some of the surgery. It might take months and months and months. Socialized forms of healthcare, not an easy answer. Let me share with you my mother-in-law's experience. In England, which is basically a universal health plan, what they call. She had to wait. She had to wait almost 5 months to get a surgery to have one of her cancer removed. That's the kind of system are we looking at in California? No. I do not agree with any of the system, what is being proposed. Free market approach, give the employers the benefits, the tax breaks, $5, $10, $15,000 to every employees who can afford to give them tax break. That'll how I propose to have the free market work.